It is time now for Dr. K, Dr. Kevin Kavanagh. Good morning, sir.
Good morning, Jack. How are you doing?
Doing well, thank you. Dr. Kavanagh is a retired physician and founder of Health Watch USA, and we got a pretty good report yesterday from the governor on our state and the situation we're in with COVID right now.
And that's correct. The thing that's impressing me most is that our cases are down almost 75%, and the positivity rate on the tests is at 5%. So that is just great. It's like a breath of fresh air. I think we're over the bad behavior over the holidays that gave us that huge surge. And right now, we just need to stay on track because we don't want to get a new spike with these variants which are coming out.
All right. What else do you have to tell us about? I know the J&J's coming out pretty soon, right?
Yeah, J&J's coming out. That's been approved. And I do need to make one correction. This would be classified as a DNA vaccine, although it will then make mRNA in the cells. So all of our current vaccines work by making mRNA, either putting it directly into the cells or making it. That then makes the spike protein, which makes the antibodies. So it is a good thing, and believe me, the J&J vaccine, because it doesn't have to be ultra cold storage, and hopefully people aren't going to have as many side effects with it, that I think it will be very accepted by the public and will be probably one of our key tools in preventing this pandemic. And remember, it prevented by 100% hospitalizations and deaths, and that even included in South Africa. Although with this vaccine, you may get some mild infections, doesn't look like you'll get very sick. At least that's what we're hoping for.
That's good. That's really good news. Now, top non-government scientists are warning something. Tell us about that.
Yeah, and this is kind of concerning. This goes back to actually in July when we started to talk about aerosolization of the virus. The World Healthcare Organization was then actually more or less pressured by some 239 experts. These are true experts, not internet experts, to say that yes, this virus can aerosolize. But despite that, most of our precautions that we have are for droplet precautions. And so right now, our situation is that the coronavirus task force of outside experts has been disbanded. President Biden is pretty much relying on just in-house government employed physicians and researchers. And David Michaels, who was the past director of OSHA, which is the Occupational Safety and Health Administration, along with Rick Bright, Michael Osterholm, all very, very top scientists, bright people, have written a letter to the White House stating that, look, this virus can aerosolize. These microscopic droplets can float around in air, travel farther than 6 feet, fill up a room. We need to be getting our workers N95 masks, adequate protection, fixing the ventilations in schools and other buildings. And this is I think, of utmost importance. We still are running on droplet precautions. That's probably not going to give you the best safety indoors. And certainly after a year, we don't need to be re-sterilizing N95 masks, etc. But unfortunately, those stopgap precautions are still being followed by some individuals and some institutions, and they're still in place with the CDC, and they should be reversed and eliminated. We should be approaching this from an airborne pathogen, trying to prevent any further spread. Because remember, Jack, even though the vaccines are here, it's going to take us several months to all get vaccinated. And until then, we need to keep everybody as safe as we can.
Always good to talk to you, Dr. Kevin Kavanagh. Thank you so much.
Thank you, Jack.